and colleagues. For today's Dr. Sheng-Po host retirement virtual webinar, we're honored to introduce Professor Itzhak Brook as our invited speaker. Professor Itzhak Brook is a physician and professor of pediatrics of Georgetown University, Washington, D.C., who specialized in pediatrics and infectious disease. He is also a head and neck cancer survivor, initially undiagnosed with laryngeal cancer in 2006, but his cancer recurred after initial treatments, and his larynx has to be removed. Becoming a laryngectomy was a trying experience for Dr. Brook, as it infected his most fundamental functions: speaking, breathing, and eating. As a head and neck cancer survivor and a laryngectomy, Dr. Brooks feels great satisfaction that his personal experience is able to help other survivors to speak again and lead a full and satisfying life. He has also authored the book My Voice, a physician's personal experience with throat cancer, and the Laryngectomy Guide. The guide has been translated into over 15 languages and is available free of charge. Today, Professor Itzhak Brook's presenting topic is life challenges facing laryngectomy. Please give a round of applause to welcome Professor Itzhak Brook.
Okay, Dr. Brook, you can share your slide now.
Good morning to you, and good afternoon, depending where you are. I cannot control my slide, I don't know.
Rolling up and down. Yes.
I see. Thank you. It's an honor to participate in the retirement seminar of Professor Sheng-Po, where I met Dr. Hao when I visited Taiwan, and had the opportunity to present the translation of the laryngectomy guide to simple Chinese assistants. And with his help, I was able to get the guide translated to many more languages in Asia, in Eastern and Central Asia, which includes mainland China, Japan, the Philippines, Indonesia, Malaysia, and recently also in India. And so I'm very grateful to Dr. Hao for his assistance and help to get this important project progress. What I wanted to talk to you today is about life challenges and returning to life as a laryngectomy. As you can see and hear, I'm using a tracheoesophageal voice prosthesis where I am able to produce voice, as you can see here, by pressing the voice prosthesis, the HME that covers the voice prosthesis. What I plan to do today is give you an overview of what it is for the patient to face cancer and radiation, chemo and surgery, how to be advocate and also speak again. What kind of preventive care the patient needs, what psychological issues they face, and finally, how is life with laryngectomy. Being a physician who experienced laryngectomy and cancer, I found myself in a unique situation that I had an insight in of what the patient goes through, as I had to undergo everything patients go themselves. And I dedicated much of my life after becoming a laryngectomy to being an advocate for patients with head and neck cancer and try to help them all over the world. Facing the diagnosis of cancer is difficult. It's a major crisis. The patient feels that he's no longer invincible. He needs to deal with mortality. He's anxious, uncertain. Suddenly, they become dependent on others. And this new diagnosis and treatment influence their relationship, their work, and they need to, as soon as they get the diagnosis, to make major decisions, what to do, how to choose a treatment, who will deliver the treatment, and whether to keep it personal or tell others. The treatment is difficult. Each of the major therapies, lifelong side effect. Radiation has serious side effect, immediate one and long-term one. The immediate one are mucositis, the reduction in saliva, xerostomia, mucositis, and dermatitis and around the area. Fortunately, they do go away, but long-term side effects are going to be with patients throughout their life. In addition to mucostomia, they may have alteration in smell, in taste, in ability to swallow, in thyroid function, in being more susceptible to infection, in damage to the neurological system, as well as damage to the carotid artery, with the possibility of developing autonomia, labile, and paroxysmal hypertension, and many more that include damage to the lymphatic system, lymphedema, as well as some of them get cognitive disorders and fibrosis. Chemotherapy has their own side effect. Many is the same as radiation, but there are additional ones, such as immune suppression and other complications. Surgery, of course, is a major event, and depending on what procedure they undergo, and they, of course, can develop swallowing issues, lymphedema, damage to the muscles and nerves that transverse the neck. One of the most important lessons I learned is that it's important to pay the patient to be their own advocate. That means that they need to become experts in their field, and they should try to educate the medical providers about their condition, even, of course, before they will know everything about their medication, being an advocate also means that they need to challenge us, the physician, by asking questions and explanation. Physicians are not perfect. Make mistakes, it's almost unavoidable. But if the patient pays attention and advocates, that can reduce those mistakes and prevent them. Getting somebody to be with you when you come to be seen or treated is important, especially after surgery when patients not always initially knowing the diagnosis is very scary for the patient. Many of them are overwhelmed by the new questions. It's a good idea to get a second opinion in case there is some controversy or issues that are not very clear. After the surgery, it's a difficult period for the patient. They are going to be fearful and anxious. Am I cured? Will I get recurrence? It's important to continue to follow the patient up. We, in the modern era, are a lot of time relying on pet. There's no substitute to adequate medical and otolaryngological examination. And it's important that the patient does not neglect other medical conditions that they may have, including cardiac, pulmonary, neurological, or the possibility of other tumors, such as prostate in men and breast and ovary in women, colonic cancers, and others. Laryngectomy have very unique challenges. In addition to the one I mentioned, is how to speak again, how to be understood, how to deal with discrimination because of our bad voice. Even making a phone sometimes difficult. Fortunately, there are ways we can speak again, either using a voice prosthesis, electrolarynx, or esophageal speech. There are now in development new modalities of speaking that hopefully will be available in the near future. Rely on intelligence, artificial intelligence, and there may be something that would become available in the next few years and may make it easier for patient to speak again. The crucial things to deal with is to continue to eat adequate food, because a lot of times swallowing is difficult. Keep hydrated. Deal with reflux because the sphincter, the upper sphincter, is removed, and patients do have reflux. The sputum production is integral part of daily life because it has to be used effectively, and it should be of good quality to prevent plugs and irritation. Psychological issues are one of the major challenges laryngectomy have to face, and that's because of the way they appear, the way they speak. They often isolated because of those limitations, and many of them have body image issues and sexuality issues, which can affect their interactions with the family, friends, and co-workers. And many of them cannot return to work or work in a different profession, which can make them suffer from economical impact. Depression is one of the major issues in all head and neck cancer. Unfortunately, suicide is high in head to lung cancer. And I will talk a little bit how to deal with depression, but it's something we need to recognize. We see patients. Some of them may resort to substance, and they suffer from anxiety and fear of recurrence. Hopefully, with time, they can deal to some degree with anxiety and fear if they can see that they are doing okay and they continue to do well after the procedure has been done. And what we need to tell our patient is how to deal with depression. Try to talk to them and prevent them from substance use, and encourage them to get help when they have depression. That can be by getting them antidepressive medication, and also by encouraging them to be connected to others, family, friends, professionals. Use laryngectomy and cancer support group. Hypothyroidism and increased depression. So we need to try to prevent it by detecting and treating it. And one of the important things that patient should do is to determine to be proactive. Try to be active in correcting the things that don't work for them. Minimize stress. Return to previous activities and hobbies. And also try to set example to others that you, despite the fact that you are ill, are fighting it and going back to life. I know that in my case, what helped me get better is to return to work as soon as I could. Return to speaking, to lecturing, to educating. But also I tried to set an example to my patients and my family that even though I had something that was overwhelming and difficult, I'm not going to give in, and I'm going to try to keep on going. And that's a struggle that I personally have almost every day in my life. The fear of recurrence is very, very hard for patients, especially in the first few years. It's difficult to accept that we don't have control, and it's unknown. It's good to try to focus on other things with oneself from the illness. And by continuing with regular medical checkup, we can make sure that the patients, if there is a recurrence, will be caught early enough. And as I said, good physical and ENT examination, as well as a study of a PET scan whenever needed according to the protocols of follow-up. One thing patient can do is to renew the spirit by devoting time to leisure activity, whatever they like. Some patients go back to the hobbies they had, like biking or even running or climbing, develop relationship with their family, and keep physically fit and active. That's very important because when the patient don't, the general condition falls down. Volunteering is something, and many laryngectomy volunteer to help who just got the procedure, and they also teach sometimes speech and language therapists as well as groups that prevent smoking by going and speaking in schools. Show young people how smoking is not a good thing to have. So finding projects that are purposefully productive. I did in my case found a new meaning and purpose by devoting a lot of my time to writing and also to making the laryngectomy guide all over the world, and by preparing new editions for 3 years. But everybody can have their own purpose and project meaningful. And support is very important. I mentioned many of those issues, but seeking support from support groups can be very helpful, especially in the early stages after recovery. Well, not everything is bad about laryngectomy, and that may be a little funny, but we don't smoke and snore. We have good excuse not to wear a tie, which I always hate. if I go by somebody who smokes, I do this. Have to deal with it. We don't have so many colds, and that's a blessing. However, still laryngectomy. I did get COVID when COVID was rampant, and unfortunately many of them got the infection directly into the stomach. We cannot aspirate. Aspiration is almost impossible, and it's easier to resuscitate us during an emergency if the person knows how to hold an issue. The laryngectomy have to be intubated directly through the stomach and not through the mouth. And that's a mistake that there's still many EMTs, an emergency room, even anesthetists don't need to be reminded. Be good. It allows me, I felt that I was lucky to have life still available. It allows a person to get in touch and to use that setback in life into something positive. And lastly, unless many other cancers like lung or prostate, we cannot hide our diagnosis. It's on our face and neck, and everybody can see it. I wear it as a sign of an example that life can still go on despite cancer. So I want to thank you for your attention, and I like to share with you my website. There's links to all those books that are in here. The Laryngectomy Guide, the expanded edition, my voice, and 26 languages that are available free for download. So I thank you for your attention and congratulations, Dr. Howe, for his retirement and for the honor in your retirement seminar. I'll be happy to entertain any questions and talk about any issues that you may raise. Thank you.
Yes, Peter.
Thank you, Professor Bruce. Wonderful talk and sharing his own experience facing a laryngectomy. So now we open to the floor to our colleagues and friends. Is there any questions or topics you want to discuss?
Yeah, I think thanks, Professor Itzhak Brook. Your talk has been very, very inspiring. That's also from many of the participants. And so as a head and neck cancer victim, and actually remove your own larynx and still willing to help the others, it's a role model for many of us, for many of us. And I actually have to congratulate you to being such a strong real person, and your spirit really encourage, including myself, to be to follow your steps. So I'm really honored to be able to help you or to work with you and to translate the laryngectomy guide. And the guide has been in, as you said, in 26 language now. And so I think in Asia area, look at the participants today. We have participants from China, from Hong Kong, from Malaysia, from Philippines, from India, from Thailand, and from Vietnam and others. And I think in each country you have a translation of your guidebook. So it's really affect and really help our people in the Asian regions. So thank you for that. And for myself, I'm really honored to be your successor, because I think you are the international international humanitarian award in the American Academy, and I'm honored to follow your step to get the same award in 2017. That's one of my greatest honor, to be able to follow your path in the international public service area. And again, I think your effort to help the laryngectomy has been to help the laryngectomy has been highly recognized, and we all from you. And I think there must be some questions or some comments from the floor. Please go ahead and speak for your own people, or for
I don't know.
Yes.
Kind of.
Sorry, I could not hear you. Who are you now? Hi, Rajiv, you want to say something? I think you are online. Yeah, I think you have translation the laryngectomy guide in Malaysia.
Yes.
Yeah,
Thank you.
so Rajiv is the past president, immediate past president of the ASHNO. So Rajiv, you want to say something?
Thank you very much, Professor Hao. Good to see you. So again, congratulations on this virtual, your virtual retirement lecture. It's been very great. So Professor Brook, it's nice to see you. We've been communicating through emails, and yes, Malaysia is one of the country who translated already your books, and it benefits a lot of our patient here. I think it's a great idea to have this kind of like a translation from experienced person who already already underwent surgery and on voice prosthesis. I'm very impressed that you give your talk throughout with a voice prosthesis. It's very clear. So I think this is, again, as Prof. Hao saying, that inspired a lot of people who, especially the patient, for them to realize that life is just continuation after they undergone all this treatment. And again, we would like to, from Malaysia, convey our thank you to Professor Brook for your extensive work on laryngectomy guide book. And again, the books is being translated already in our country. Thank you. It's good to see you, Prof. Brook.
Thank you very much. It's a pleasure to see you all.
Well, thank you, Rajiv. Is there any more comments? Perhaps we should invite the current ASHNO president, Professor Pesobut Vedanasep from Thailand. Can you speak something for us?
Yes. Yes, thank you, Peter. And thank you very much, Professor Brook. I'm from Thailand, and we have faced the same problems as you just mentioned in your lecture, and I can see that is very inspiring for not only as a person who faced the same situation, but also for the physicians, and how we can handle this well. And although it has not yet been translated into Thai language, I believe that we can work out to see that how we can bring this this guideline to benefit to our patients, because we also have this kind of the group therapy for this group of the patients, but we have not yet had the official guides that may be benefit to our patients. So I would like to express my sincere thanks to your presentation, and yeah, in the future, if we can work on that, how we can make it translated into Thai, that would be great. Thank you.
I would appreciate. I have been trying to translate it to 10 years, and I was not able to do it. And I would be very grateful if we can work together and have it translated to Thai. Perhaps you can write to me, and we can communicate how to do it together. It'll be a great benefit to the patient in Thailand.
Thank you very much. Yes, certainly.
I've been to you many times, and I enjoyed it very much. And in all other countries, in Malaysia, Indonesia, Philippines, India, Pakistan, and I really love that part of the world. Of course, Singapore and Hong Kong.
Thank you very much, Prof. We'll keep in touch.
Yeah, thank you. I guarantee I will keep you. I will connect you tools together and try to help the laryngectomy guide translated to Thai languages. So I will do that today. Thank you. Is there any other comments or questions from the floor? Well, if there isn't, I'd love to thank Professor Brooks again, and thank you for your help, and thank you for your enthusiasm to help the, not only the laryngectomy, but also the head and neck cancer victim, and tell us how you could or how you suggest us or the victims to face the difficulties of life. And so thank you very much for your time and for your enthusiastic, spirit, and have a good day. So I'm going to thank you, Professor Brook. Thank you. And, before I close the webinar, I'd love to just a few introduction of the next few speakers. Tomorrow will be Professor Lin Chi-min from Singapore. He will talk about the nasopharyngeal carcinoma, which is a very important cancer in Taiwan. And after Professor Lin Chi-min's talk, in April, we have around 10 speakers from all over the world. So please, log in every Monday and Tuesday, and love to see you all in the air. So thank you again for your participation, and thank you, Professor Brook. Thank you. Bye-bye.
Thank you.
Thank you, Professor Brook.
The pleasure, thank you.
Thank you, Professor Brook, again. Thank you so much.
Oh, yeah, how?
Hey, Zhao Zhen. 真希望
我全程听了，我全程听了。
对，这个，我那时候有跟那个周良，把它就是用那个简体字的版本，所以简体字的版本早就在差不多10年前，大概就有了。对，这是我那时候跟周良一起做的。
对，
是，好，谢谢。
谢谢。
谢谢。
嗯。